Hello, everyone. My name is Tristan Spooner, and this is Understanding Learners with Special Needs, Autism Spectrum, and Low-Incidence Disabilities or Conditions. What are attributes of students with low-incident disabilities? As you can see, I added the 4 common characteristics that range between low-incident disabilities and disabilities to the extent that you're likely not going to teach many of these students. I added the chart that was provided in the book that shows how prevalent each disability is, which I actually found to be very interesting. Multiple disabilities is actually really common, unlike other disabilities that I feel like are more seen to be disabilities, such as deaf and blindness. I also added this quote here, which was my takeaway from this part of the chapter, that says, "When negative assumptions about disabilities are not permitted, but high expectations and effective interventions are the norm, the outcome can be remarkable." I think that that's a very important statement to take away, especially moving forward into the classroom. What are the attributes of students with autism spectrum? So, what is the autism spectrum? So, it's just a developmental disability that usually revolves around communication and social interactions. This is usually found in young children, but also people can be diagnosed with autism at any point in life, truthfully. So, there are 5 types of specific disorders. The 5 types of specific disorders are listed here as autistic disorder, childhood disintegrative disorder, Asperger's syndrome, Rett syndrome, and then persuasive developmental disorder, not otherwise specified. However, I do know that I did a little bit of research because I thought that Asperger's syndrome is not really referred to as Asperger's syndrome anymore. I couldn't really find any information that stated that was true, but that might be a question that we can discuss further on in the questions. But anyways, autism, I chose this chapter specifically because autism kind of is close to my heart. I know a lot of people who suffer from autism spectrum, or who are on the autism spectrum, and I think that it's really something that everyone should learn about. So, characteristics of autism. I listed here a few characteristics that teachers can identify when potentially trying to diagnose if their student might have autism. One of the biggest ones, though, was repeating certain behaviors or having unusual behaviors. The other 3 that I didn't mention here, but that are stated in the book, are having overly focused interests, such as moving objects or parts of objects, and having a lasting, intense interest in certain topics, such as numbers, details, or facts. Those are the 3 main identifiers, I believe. Besides the social aspect, is the behavior issue. And then in regards to the social communication, if the student is slow at responding or fails to respond at all, don't really catch verbal cues, they kind of babble on for the first few years of life. They repeat a lot of words or use words that seem odd. These are all characteristics of autism that are specified to potentially identify autism. Attributes of students with health impairments or special healthcare needs. This was put into 2 categories to identify as chronic illness, which are listed below, or infectious diseases, which are also listed below. I found a really interesting fact that asthma is actually the most chronic disorder of children. So, multiple severe disability characteristics. I've listed here all the characteristics, which are limited speech or communication, difficulty in basic physical mobility, tendency to forget skills that are rarely used, trouble generalizing skills from one situation to another, a need for support in major life activities, response to challenge, and gain in independence. I also noted that technology was stated to be a massive help for multiple severe disabilities, so I've listed the reasons that technology also helps. Characteristics of students with developmental delay. So this is when children with intellectual and developmental disabilities or developmental delay between the ages of 3 and 9. So what is intellectual and developmental disability? This could be speech, this could be hearing, this could be reading. It's pretty much just any form of delay in development, walking, talking. So it also stated that professionals are hesitant to assign incorrect disabilities labels on students. So labeling that they're just having a developmental delay is kind of a barrier between actually assigning a disability to a student. And yeah, so they just believe that the student is behind in motor skills or their speech or social skills, and that they have the ability to catch up. You'll assign just developmental delay instead of doing further investigation on other problems that you could assign to the student. Attributes of students with physical disabilities, otherwise known as orthopedic impairments, is when individuals who face challenges because of the structure or the functioning of their bodies. There are two major groups, which is neuromotor impairments and musculoskeletal conditions. There are three specific neuromotor impairments that are specifically important for teachers to know because they're the most common, which is cerebral palsy, seizure disorders, or epilepsy. Epilepsy is when students have seizures and can have long-term effects afterwards. The musculoskeletal conditions, could be arthritis or limb deficiencies, which basically hinder a student's learning ability based on like just the physical attribute of writing, typing, whichever, depending on their actual disorder. Attributes of students who are deaf and hard of hearing. So there's two types of hearing loss. One is hearing problems that are severe enough that it will affect their ability to process spoken or auditory information, and hearing problems that are less severe and just considered hard of hearing. Hearing problems that are severe enough usually consist of students having to wear a hearing aid. Next one is dimensions used to describe hearing problems. There's three. It's the type of loss, the age of onset, and the degree of loss. Attributes of students with visual disabilities, otherwise known as how much residual vision a person has or can use to do well in school. Visual disabilities are expressed in 4 different ways: by identifying the reason for the visual loss, by considering the severity of the problem, by taking into account when the loss occurred, so is it gradual, all of a sudden, by determining whether the criteria for being considered legally blind are met. You can be legally blind in one eye or both. Those are attributes that students could deal with visual disability. Attributes of students with traumatic brain injury. So the most common cause of TBI was being struck by or being hit by an object falling, or an automobile accident. The attributes of traumatic brain injury can usually entail loss of memory, or the student can't process information properly. This ranges from severe or mild. Those with severe are usually home instructed and getting rehab. And 26,000 students with TBI were served by special education in 2015. I actually was super interested in the traumatic brain injury. My uncle actually had a traumatic brain injury once, and it's very interesting to watch the development of someone coming back from such a disability. But I think that this is really important to know because, this isn't a disability that someone is born with. This is just a freak accident. Attributes of students with deaf blindness. So this is a combination of vision and hearing loss. Deaf blindness encompasses a spectrum from mildly hard of hearing plus mildly visually impaired to totally deaf and blind, or combination of the severity of vision and hearing loss. It is rare that an individual with deaf blindness could be completely blind or completely deaf, but either the vision and or the hearing loss can be present at birth or acquired. One of the biggest role models that was also deaf and blind was Helen Keller. She's one of the biggest role models because she graduated college in an era that all of these disability sped and tools were provided for students to excel in school when they have disabilities like they do now. But they said the book states that when you hear the term deaf blindness, you probably think of people who just have no vision and no hearing abilities. But it's actually just like who live like restrictively, like they're not fully blind or they're not fully deaf, but they might have like partially blind in one eye and deaf in one ear or something of that sort. Questions. Okay, so is it possible for a child with autism to move up on the spectrum? By this, I mean, as time goes on, could a child's autism technically get worse or better? Are they able to move up or down on the spectrum as time goes? Or are they pretty much set where they're at from when they are diagnosed? My second question is, what are the attributes of students with physical disabilities? I mentioned some of the attributes of physical disabilities, but there's definitely a ton more that we can dive into, and I think that these questions will be really good at creating a discussion moving forward. Thank you, y'all, so much for watching my presentation on Chapter 6. I look forward to answering any of your questions, so feel free to ask me anything that you'd like. I also added 2 more resources that you could read to follow up on autism in the classroom in the link below in the bio and also right here on the forum. I also added 1 more YouTube video that I personally got a lot out of to take away from about autism in the classroom as well. So please feel free to look at all those resources as well. Thanks so much.